So like Cassie was saying, my name is Aislinn Rogalla. I'm a family medicine physician over at Grand Itasca. I was born and raised in Pine City, but I've traveled a bunch for my medical education as well as my medical training, and now I'm back closer to home. I moved up here at the end of October, and I've been seeing patients since the beginning of November, so I'm still pretty new. But here tonight to talk to you about diabetes prevention and management, so we'll get started. So you may know this, but there are essentially two different types of diabetes. Type 1 is often referred to as juvenile diabetes or insulin-dependent diabetes, though insulin could be used to treat both of these types. It's a chronic autoimmune condition in which the pancreas produces no or very little insulin. Typically, patients present as a child, which is why the juvenile diabetes portion comes in. There's no real screening for it because there's not any agreed upon lab reference ranges to actually test for this. And because there's no screening and there's really nothing that you can do to prevent it, that's why they don't recommend doing any screening for it. Type 2 is the type that we're going to focus more on for this talk. It was formerly referred to as adult onset diabetes, but with the growing obesity epidemic in the United States, we are seeing it in younger and younger people. So that's not completely accurate anymore. It's characterized by high blood sugar, resistance to insulin, and then you can also later in the disease develop that lack of insulin that kind of mimics the type 1 diabetes. So why is this important? These are some maps that I took from the CDC website, and it shows the prevalence of diabetes in the U.S. Now, note that this is just among adults, like we talked about earlier. We are beginning to see more and more of a problem in children, and they adjusted for age for this map. So that's 1995. If you can't see the colors down here, yellow is 4.5 to 5.9%. And there's no red on the map, which is the highest percentage. This is 2015, so the information is a little bit outdated. Obviously, it's 2020 now, but that's how much it changed in that time span. So it's becoming a huge problem. Red is greater than 9%. So why is this important? Uncontrolled or untreated diabetes can result in a lot of problems. Blindness, amputation, kidney failure, as well as blood vessel and heart disease. So it's really important that we get it diagnosed and treated to try and prevent these complications. How does someone develop diabetes? It's a very complicated process, and we don't completely understand it at this point. There's still research going into figuring out how exactly this happens. But essentially, for type 2 diabetes, excess adipose, what we refer to as fat tissue, leads to decreased insulin sensitivity, and then that can lead to decreased production of insulin by your cells in your pancreas. Now, genes, your environment, your lifestyle, your socioeconomic status, and even your microbiome can affect that process happening. So it's very complicated and like I was saying, incompletely understood at this point, but that's a general breakdown. So what are the risk factors? This is taken from the American Association of Clinical Endocrinologists. Different diabetes groups will put out different risk factors. This is one of the more all-encompassing ones that I found, so I thought I'd put it up here for you guys. But if you take a look at it, age is definitely a factor. Once you're over the age of 45, you're at an increased risk. Medications can put you at increased risk. If you have any family history of diabetes, it puts you at risk, as well as your cholesterol. If you had diabetes when you were pregnant, if you have high blood pressure, if you're overweight or obese, all these things can put you at risk for diabetes. And as we talked about with obesity becoming more and more of a problem in this country, we're seeing a lot more diabetes. So why should we screen for diabetes? Like we talked about, it comes with a lot of other disease processes, and it can cause a lot of complications. So it's important to catch it early and start treatment. There are many reliable tests for the diagnosis and screening of diabetes, and there's something that we can do to prevent the development of it. Lifestyle modifications and medications reduce the progression, even in people who don't have any symptoms yet. Screening may begin to show benefits in mortality, which would be, death from the disease process after 23 to 30 years. So it's really important to catch it early. So, who should be screened? They put out different recommendations based off of what stage in your life you are. For non-pregnant adults, they recommend screening between the ages of 40 and 70 in people who are overweight or obese or have any of those risk factors that we talked about earlier on that map. Some different organizations will suggest screening after 45, but this is one of the earliest ones that I found, starting at age 40. Now, pregnant women, for anybody who's ever been pregnant or knows somebody who's been pregnant, they recommend screening during pregnancy, and part of the reason for that is people who've been diabetic during their pregnancy are at increased risk for then developing type 2 diabetes later. And different organizations have different recommendations for when to screen. The American Diabetes Association, ACOG, which is the American College of Obstetrics and Gynecology, and then the CDC all recommend screening in the first trimester. The United States Preventative Services Task Force and the American Academy of Family Physicians recommend screening after 24 weeks, which would be that marker for the first trimester. So they disagree a little bit on when to do it, but they agree that it should be done. For children, we have recommendations now for screening because we talked about seeing more and more of this in children. Under the age of 18 who are overweight or have 2 risk factors, they recommend screening. Now, in children who have a lot of risk factors and a very strong family history of diabetes, I've seen recommendations where you could start at age 10 or even younger and screen yearly for them just to try and catch it early. For older adults, there's not a lot of great evidence after age 70 for screening, and that would just be a discussion that you would want to have with your doctor about whether, screening and treatment would be beneficial for you based off of any other medical issues that you have and what kind of side effects and things like that you might expect from being screened or being treated. So, how do you screen? Most of these tests are blood tests. Well, I guess they're all blood tests. One of them requires a little bit more time to do. Hemoglobin A1C is a term that we use for testing the red blood cells. All the red blood cells in your body carry, they're like glycosylated, so they carry a little sugar on them. And red blood cells turn over in your body about every 90 days. So whereas if you look down at the next one, the fasting plasma glucose, that's like taking a picture of what your blood sugar is. If we test your hemoglobin A1C, that's like getting a 3-month movie of what your blood sugar is. So it gives you an average about what your blood sugar has been doing versus just a quick picture. If the hemoglobin A1C is greater than 6.5%, that's a diagnosis of diabetes. If your fasting blood sugar tested through your blood, so when you haven't eaten anything yet, if that's greater than 126, that's a diagnosis of diabetes. Now, obviously, if you had eaten something and it was over 126, that changes things. This is for only if you haven't been eating. If they check just a random blood sugar test, and random means, you could have eaten, you could have not eaten, and it's greater than 200, and you have symptoms of diabetes, that's a diagnosis of diabetes. The one right above that I skipped over, that 2-hour plasma glucose greater than 200 during the oral glucose tolerance test, that would be a test where you would drink a 75-gram sugar solution dissolved in water, and then you would hang out for 2 hours and they would check your blood sugar. And somebody who didn't have a problem with their whether it was with insulin resistance or producing insulin, their blood sugar should be lower than in somebody who did have a problem. So if it's greater than 200, those 2 hours after you drink that solution, that's a diagnosis of diabetes. There's also something called pre-diabetes, and I would say people probably know a little bit less about this, but that is a diagnosis that essentially says that you're at an increased risk for developing diabetes. And that can also be diagnosed with blood tests. Once again, that fasting blood sugar when you haven't eaten anything, if it's mildly elevated but not to the point where we would say you have diabetes, that's indicative that you're starting to have some problems with insulin resistance, or not producing your insulin as well. And that would be 100 to 125. And so we would say you're not at the point where we would diagnose you with diabetes, but you're definitely at risk of developing it. Once again, they have a 2-hour plasma glucose cutoff, and then also the hemoglobin A1C cutoff, which is anywhere from 5.7 to 6.4%. All those things would suggest that you're at an increased risk to develop diabetes. So, increased risk. Why does prediabetes matter? It essentially matters because of that increased risk to develop diabetes. If you look at somebody who's pre-diabetic and you look at the next 5 years, the risk of developing diabetes for that population is 9% to 25% if the hemoglobin A1C is between 5.5 and 6. So if you remember, to be pre-diabetic, your hemoglobin A1C needed to be greater than 5.7. So really, if you fall in that group of people whose hemoglobin A1C is 5.7 to 6, your risk in the next 5 years of progressing to diabetes is 9 to 25%. So, up to a quarter of people are going to progress to diabetes. Now, if your hemoglobin A1C is in that 6 to 6.4 range, the higher end of the pre-diabetic, your risk is 25 to 50%. So up to half of those people in 5 years would develop diabetes. So it's a significant risk. So how do we prevent it? Lifestyle interventions center on improving nutrition and increasing physical activity to promote weight loss and lower that risk of developing diabetes. There was a study done by the U.S. National Diabetes Prevention Program, and they had 3,200 people participate in this study. They were randomly assigned to be in a treatment group. One was just routine care, kind of keep doing what you're doing. One was to start a medication called Metformin, and the other group was assigned an intensive lifestyle modification or intervention program that involved adjusting their diet as well as their exercise regimen. The intensive lifestyle intervention, how they defined that was all these people were going to have a goal 7% reduction in their weight. So their goal throughout this time period was to reduce their weight by 7%. They were going to try and get 150 minutes of physical activity per week, and they adhered to a reduced calorie and reduced fat diet. After 2.5 years, the incidence of type 2 diabetes was reduced by 58% in that lifestyle intervention group. Metformin showed a good decrease as well with 31%, and then only 17% was reduced in just kind of doing the routine baseline care at that point. So there's been significant improvements with this lifestyle intervention as well as medications, and those can be used together. So if we talk a little bit about Metformin, that medication, you may have heard of that before. It's a pill that you take. It's not an injectable medication. When it was first being proposed, there was some concern that it would cause something called a lactic acidosis, which is a buildup of lactic acid in your blood, and it can cause kidney problems and things like that. So people were hesitant to be prescribing it, but they did another study that basically showed there wasn't an increased risk of that. So if you come across anybody saying, oh, you're on Metformin, you should be concerned about this thing, you can tell them, nope, they did another study and there's not an increased risk of that. The biggest complaint that people really get with Metformin is that it causes some GI upset, some abdominal pain, cramping, bloating, and then some looser stools. This does get better the longer that you're on Metformin. People might have symptoms for the first 2 weeks and then that'll go away. One thing that can help with that is starting at a lower dose and slowly increasing that medicine. So usually the goal is 1,000 milligrams twice a day, and your doctor might start you at 500 milligrams once a day and slowly increase that to try to help with any side effects. Another thing that comes with metformin is you can get a vitamin B12 deficiency, and that's just because of how it affects that vitamin's absorption in your GI tract. So that's something to be aware of, and something that you might just need to take extra supplementation for if you were to begin having problems with that. But when we look at metformin in and of itself, when it was compared with that placebo or the routine care, it had that 31% risk reduction. In clinical trials, it's shown to be more effective in people younger than 60, people who are obese, and then women who've had that history of diabetes while they were pregnant. And it's safe, tolerable, and cost effective. Like I said, the worst side effects are really that GI upset, which can gets better over time, and you can try to prevent it by slowly increasing the dose. So it's a good medication. In conclusion, diabetes is increasing throughout the United States, and part of that is we're heavier as a group of people, and then I think part of it is also that we're better at diagnosing and screening for this. But significant morbidity and mortality, that's death as well as disease complications, it's associated with diabetes. Screening tests are available. People who are overweight or obese between the ages of 40 and 70 should be screened, and people with risk factors should be screened. The disease process can be delayed or even prevented through intensive diet and lifestyle modification and medication. So it's a pretty serious disease. It's becoming more common. We can screen for it, and being proactive about treating it can help prevent it or delay its progress. So it's very important. Now, here at the Y, there is a diabetes prevention program. You're eligible to participate if you're at risk for type 2 diabetes. There's a session coming up if you want to know a little bit more about that. And they have classes held on Mondays, so that's something to know about that's going on right here in your community. There's also a diabetes support group, and that's an opportunity to meet other people who have diabetes and talk about what's worked for you, what hasn't worked for you, and just generally share those experiences with somebody who has been through it, is going through it, and understands. It's led by Suzette, a member at the Grand Itasca diabetes team. It's open to individuals with both type 1 and type 2, and it meets the fourth Thursday of every month. So that's another great resource if you hadn't heard about that yet. All right, this is just a list of resources that I used to compile this data for you. Oh, thank you.